مساء الخير عليكم جميعا وصباح الخير علينا هون في أمريكا. اليوم بحب أتشكر كتير دكتور أليكس رازولي رح يشاركنا اليوم في مقابلة على إنستغرام بخصوص فقرات الرقبة والظهر. رح نتكلم عن الاستبدال القرص باستخدام القرص الصناعي أو الدمج، وهي العمليات المعتاد عليها. رح استنى يشاركنا هلأ كمان شوي دكتور ألكسندر راسولي، نيوروسيرجن، أخصائي في الفقرات العنقية والقطنية، طبعا بما معناه الرقبة والظهر. أهلا وسهلا فيكم من كل بلد، تحياتي لكم جميعا، إن شاء الله تستفيدوا. اليوم بفقرة اليوم بدنا نتكلم حقيقة عن عمليات الاستبدال القرص الصناعي. هي سو فار حديثة، ودكتور رازولي بيتواجد في الدوحة في قطر في نهاية شهر واحد لإجراء مثل هاي العمليات. أهلا وسهلا فيكم. أنا بستنى دكتور رازولي يشاركنا to join us، أو أنا ممكن أطلب منه to join us من إذنكم دقيقة. Let's see. No request. So, Dr. Rasouli, I want to thank you so much for joining us on Instagram Live. Hello, good morning.
Hi, Javier, how are you? Good morning.
Good morning. We're very happy to interview you on our Instagram. We're excited to talk about your trip to Doha, and we're excited to talk also about the ADR cervical lumbar with you today. So a great welcome from everyone. So our first question to you, can you briefly explain to us the difference between the ADR cervical lumbar versus fusion?
Yeah, I think the best analogy would be that if you had a car or a vehicle that developed a faulty part, would you weld that part to the car and lose that functionality of the car? Or would you exchange the faulty part for a new part? And that's the difference between fusion in the first case and disc replacement in the second case. If your vehicle develops a problem, the most logical thing to do would be to take out the part that's broken and put in a new part. And that's what a disc replacement does in the body. So in the human body, in the spine, if we have a faulty disc, traditionally what surgeons would do is take out the disc and then put in screws or rods or plates or some metal and make the bones on either side of that disc melt together or fuse together, which may have been good in the short term, but in the long term, patients developed a lot of problems above and below the area of the surgery. Nowadays, with disc replacement, if a disc develops an issue, all we have to do is remove the disc and put in a new disc without having to bother with any kind of other implants that would cause dysfunction down the road.
How long does the procedure take compared to the old fusion procedure?
It really depends on who does the surgery and how many discs have to be changed. I think in the most experienced hands, a single level disc replacement, whether it's in the cervical spine or the lumbar spine, should take no longer than about half an hour. 2 discs should take no longer than 1 hour. 3 discs should take no longer than about an hour and 10 minutes or so. But it could take upwards of 3 or 4 hours if somebody without that much experience does it. It really depends on experience level and the number of discs.
Does everyone qualify for the ADR?
Not everyone, particularly in the lumbar spine. More people will qualify for it in the cervical spine because the structure of the neck is a little bit more forgiving for disc replacements. But most people between the ages of 20 and 65 will qualify for disc replacement.
I see. So our next question was, what is the advantages and disadvantages? And I think you kind of explained it, but can you go over it one more time? The advantages of the ADR.
Yeah, to be more specific about disc replacement, the primary advantage is that you're preserving motion where the surgery is done. You're not locking the spine into a fused state where it can't move as it's supposed to move. The second advantage is that patients who have these surgeries heal much faster than those who have had fusion. The third advantage, which studies have shown us, is that the people who undergo disc replacement are able to return to work on one hand and return to full activity on the other hand much sooner than those people who have fusion. And finally, the added benefit is that people who undergo disc replacement uh, much less commonly undergo a second or third or fourth procedure, which, as we know, has traditionally been an issue with spinal surgeries. You get one spine surgery, then you have to do another spine surgery, and then another spine surgery, and we're not really seeing that with disc replacement at all.
Wonderful. What about the pain level after the surgery?
Surgery involves some pain, some soreness. How long that soreness or pain lasts is the real question. And with disc replacement, we were seeing that patients usually get over the pain of surgery within 2 weeks, sometimes several days.
I see. And recovery period going back to their normal driving, normal life activities?
Depending on the surgery that's done, in the neck, it's much faster and it's between 2 to 6 weeks. In the lumbar spine, it's closer to about 6 weeks where you go to enjoying a full activity, but sometimes it can take longer than that as well.
For a healthy person with the least comorbidities, how long do they need to stay in the hospital after surgery?
So that's the remarkable thing. In the last few years, and particularly during and after the pandemic, we found that we could do these surgeries without having to go to the hospital. Or at the most, patients would spend a night in the hospital, if that. And this was during the time when hospitals were shut down for various reasons, some of them valid, some of them not very valid. But we were able to retool and repurpose our surgeries so patients could actually go home the same day. And that has a lot to do with anesthesia and the protocols that our anesthesiologists developed for our patients.
I see. So you recently returned to Doha. Could you tell us about your trip to Doha and what is motivating you to go and operate in Doha?
Several things. I have to tell you, Doha in particular and Qatar in general is a very remarkable country. It's an example of how the GCC, and in particular Qatar, is taking the God-given wealth of the nation, investing it into the nation and the people. And you see this everywhere you go in the infrastructure and the commitment to cultural betterment, in terms of the quality of life. And one of the final frontiers of this sort of revival and renaissance in the GCC and in Qatar in particular is healthcare. My personal experience with Doha was to meet a patient to do surgery there, and when we got to the hospital there, the View Hospital, we were asked, Rasouli Spine was asked to help them develop a spine program. And spine surgery, as you know, is very technically complex and skill sensitive. And so we were very happy to help them build that program. And I think in the short term, we will be doing surgeries for the wonderful people there. And in the long term, we will be helping to develop some of the skills locally for surgeons to then take over the project. But the main aim is to bring the latest and greatest techniques to Doha, to Qatar, and to the GCC, because the mission of those cultures is the same. Take the resources that nature has given them and invest it back into the people. And I think it's remarkable to have countries that are committed to doing that nowadays.
Yeah, beautifully said. I can add to that. And besides, you're gonna be going in January. It's gonna be a beautiful weather. I hope you're gonna enjoy the scenery there and the people as well.
Yes,
Um,
absolutely.
so to get an appointment with you, do we need, is it virtual for now? If it's virtual or versus in person, can you explain that to us?
Yes, the difference between virtual and in-person appointments touches upon a number of factors. Certainly, for convenience sake, we offer virtual appointments, and we don't need to be in Doha. We could do it anywhere. Um, some patients, though, enjoy the direct interaction with the doctor live, in which case they would have to wait for us to go to Doha. And in some cases, for some spinal issues, we need to examine the patient in person. For other spinal issues, the MRIs are so good these days that we can basically predict and diagnose just by the MRIs. But for some cases, we need to see the patient in person. So it's either patient preference or the particular pathology that dictates whether we can do a virtual or in person, but both are available.
So most important is, let's say, a recent MRI, a month old, 2 month old. What is the longest you could accept for an MRI?
Usually MRIs don't change very rapidly. So if you were to see an MRI from 2 months ago and compare it to an MRI from, say, a year ago, usually for most cases of spinal issues that take many years to develop, it doesn't really matter. For for tradition's sake or convention's sake, an MRI more than 6 months old may need to be renewed with a more current MRI.
Okay, perfect. Well, I'm so glad you're gonna be in Doha. People needs to benefit from this. I know there's a lot of people who really seek this help. There is people that I met that they've been waiting for an advanced surgery in the spine before they really do the older. They always believe that there will be an advancement. So hopefully they will benefit from your visits and they will come to see you and your team in Doha, and we'll look forward for you to be also in Dubai, Kuwait, Saudi Arabia, and all the region as well in the future. Could this be a possibility too?
It is certainly a possibility. It's certainly an aim for us to leave behind a legacy in the region. It's very important to us for professional and personal reasons, and we very much look forward to it.
All right. Well, thank you so much. We will announce the dates of your arrival to Doha. And if anyone would need to take an appointment, so feel free to direct message us and we will coordinate everything. Thank you
Great.
so much, Alex. We really appreciate you.
Great to see you, Veer. Happy
See
holidays.
see you soon. Happy holidays to you.
Bye bye.
Bye-bye.
Take care.